Good morning, good afternoon, and good evening, everybody. Welcome to day 3 of the first Innovation Forum in the WHO Western Pacific region, and to this panel in particular titled Implementing Digital Health Innovation, Technology, Governance and Society. My name is Daryl Barrett, and I'm the coordinator of the Health, Law and Ethics team here at the WHO Regional Office for the Western Pacific. In this panel, we'll be looking at how technology, governance, and society interact, and how their interaction can enhance the public benefits of innovation. We know that governance supports digital technology and innovation, and governance that does that in a safe and sustainable manner for the public good is a foundation for addressing the current challenges we're experiencing with COVID-19 and as we move forward. As the Regional Director, Dr. Takeshi Kasai, said on the first day of this forum, digital technology can be a powerful tool for surveillance and health service delivery and help social connection, but it can also propagate misinformation and undermine privacy and human rights. To explore the topic of digital governance, we're fortunate to be joined by a panel of esteemed experts from across the region, and they'll present their experiences and perspectives on implementing digital health innovation. Now, today we're going to split the panel into 2 blocks, and each has 3 speakers. After each block, there'll be a short discussion time for some questions which you can submit for our panelists. Please use the chat function that you see on your Zoom facility. If we could move to the next slide, please. We're also fortunate today to have illustrations by Pushpin, which will present for us on a summary of the panel. I would also like to present some general housekeeping. If you could be sure and use your real name as your log on, that will help us to identify who's joining us today. And also it's important that you understand the disclaimer that implementing digital health innovation, technology, governance and society, we invite you to participate in an exchange of ideas on this subject. Please make sure, as I mentioned, that you put your first name and your last name, and please also refrain from any marketing of products or services or taking political positions. WHO Wipro reserves the right to remove any participants or posts not adhering to these guidelines. And I look forward to a rich and joyful discussion this morning. And as a brief presentation to all of the speakers, I'm going to do that in one group and then we can move forward. So our first speaker in block 1 is Jonathan Lieberman, Associate Professor in Law and Global Health at the University of Melbourne in Australia. Jonathan's going to provide an introduction to governance and health as a foundation for innovation. Jonathan will be followed by Dr. Elvin Marcello, the Executive Director of the Asia eHealth Information Network and Senior Vice President and Chief Medical Officer at St. Luke's Medical Center in the Philippines. Elvin will discuss health governance as a pillar for maximizing health outcomes and how that will apply moving forward with governance and digital governance. Our third speaker in this panel will be Ms. Bakai Kamariki. Bakai is the Chief Statistician from the Ministry of Health and Medical Services in the Solomon Islands. Bakai will discuss how the health sector can plan and implement actions to build capacity and integrate new technologies to support health objectives. After Bakai's presentation, we're going to have around 10 minutes for some questions before we move on to our next block of speakers. Now, within our second block, we're going to explore some specific examples of how digital technology and innovation are utilized in the region. And to start us off in that block, we're going to have Ms. Shan Zhu from the China Academy of Innovation and Communication Technology. From her experience in China, Shan will present on governance issues related to how the health system can and should connect across government with key non-state actors. We will then move to Dr. Alicia Sahukan, who is the Head of Health Protection at the Fiji Ministry of Health and Medical Services. Alicia will highlight the experience in Fiji related to their digital contact tracing app technology and how this is supporting their COVID-19 response. And then our third speaker in block 2 will be Dr. Michael Noonan, who is Director of Beyond Essential Systems. Michael will present on the potential for innovation to drive health improvements in low resource settings, in particular to support health service delivery, and he'll draw on his experiences in the region. So just a reminder for our attendees online to submit any questions that you have for our panelists via the chat function. So with that, I'd like to get started, and I'll pass on now to Jonathan for our first presentation. Thank you.
Thank you. Thanks very much, Daryl. Thanks very much for the invitation. It's fantastic to be part of this session and looking forward to learning from all of my fellow panelists. Joining you from Melbourne, Australia. I'd much rather be together in person, as I'm sure that we all would be. I'm joining you from my home office where I've been working for the last 6 months or so. Let's start with the primary concern that brings us together in this forum, which is health, and how we can collectively realise the right to the highest attainable standard of health for all people. Now, of course, health is very complex and multidimensional. And if we're to realise this ambition, we need to govern the way we conduct ourselves as societies and as individuals at national, at subnational levels, and also at international levels. So when we think about governance, we naturally think about law, though of course not only about law. And law is, or at least can be, should be, an incredibly powerful enabler of good health at both individual and population levels. But as I think we all know, law can also be a constraint or an obstacle to attaining good health. And this is, of course, true of innovation as well. How can we use law to realise the promise of innovation, and innovation of many different kinds as explored by this excellent forum? And realising the promise of innovation includes both harnessing the power of innovation and everything it has to offer, and reducing risks and unintended consequences, and building in processes for constant learning, review, refinement, and improvement. So law for health innovation, there's so much that we could say about this. So what I want to do is just make some general remarks with the topic for this session, digital health innovation, in mind. And I hope these remarks are helpful for the discussion that follows. So if we start with that ambition that brings us all together, the highest attainable standard of health, perhaps our first question is about what are we trying to achieve for health through innovation? And this isn't always straightforward, and we need to examine this from different perspectives, including from different disciplinary perspectives, to know what the problems are, what their causes are, what interventions are likely to work, how we target our interventions, how we know what we know, how we test our interventions, and how we set ourselves up for that ongoing learning that I mentioned. And we're really talking about evidence of very different kinds here: epidemiological, medical, behavioural science, communications, economic, and we could go on. And I know that this need for multi-sectoral, multidisciplinary collaboration has been a theme of the Innovation Forum as a whole. So while our starting point may be health, I think we can also think about other starting points for health innovation. There's much innovation that doesn't start off as having anything to do with health, and I think much digital innovation can be thought of like this. But we who think about health see the opportunities to harness innovation and to adapt it for health. So once we know what we're trying to achieve for health, we need to ask what is within the influence, the power, the mandate of what we tend to think of as the health sector. And of course, we know that there is much that isn't within the power of the health sector. So we need to identify where the other influences, powers, and mandates are, and work out how to collaborate and partner, which isn't always easy because it takes us out of our comfort zone, beyond our expertise, and into new relationships, which often need to be built from scratch. And if we're thinking about the role that law plays or can play, we're asking questions about the laws we already have in place. how they apply to the things that we want to do or the things we want to stop, or at least change, whether we need new laws, and if so, what kind, at what level, national, subnational, or international, and which of these can be led by the Health Ministry or the Health Department, or at the international level by WHO. And again, we know that many won't be. In health, we often think about the role of finance ministries, education, housing, environment, planning, trade, and so on. And when we're talking about digital innovation, obviously ministries of communications, information technology, and industry. So against that background, I want to make 6 brief comments that I think are broadly true of law for health generally, but apply in important ways to digital health innovation. The first is that it's in the nature of innovation that it moves quickly, and this is not always the case for law. Though COVID-19 is in some ways an exception, where we've seen new laws introduced in many countries virtually overnight. But ordinarily, law is often playing catch up to real life. And added to this is that much innovation, particularly digital innovation, comes from outside of government, particularly the private sector. And the knowledge of the private sector is often ahead of government, making the task of regulation that much harder. Law can be complicated at the best of times, and if we try to get law perfect or even close to perfect before we implement it, we'll never be able to catch up. And I think this focuses the mind on the most important things that we want to protect through law, even if we can't regulate for every detail, for every change that may come. So second, in relation to digital technologies in particular, I think we need to prioritise protection against the misuse of people's personal information, whether by governments or others, whether in ways that discriminate, for example, in access to services, contribute to stigma, or the misuse of our information for commercial reasons. We have to collect information. COVID-19 crystallises this, but it's always the case. Information is central to all aspects of public health policy, administration, resourcing, and to individual treatment. So we need to prioritise these protections of people's personal information, both to prevent these kinds of misuse, but also because they are essential to people's trust in digital technologies. So my third point is that we should always be thinking about equity, about vulnerable and disadvantaged groups in respect of any legal interventions we introduce. Some well-intentioned interventions may not be sensitive to the circumstances of vulnerable and disadvantaged groups. And in the case of digital health innovation, we need to be conscious of the digital divide, both within countries and between countries. We have to do our best to use digital technologies in ways that don't marginalise, exclude, or put at risk those with less access to digital technologies, whether that is as individuals or as communities. Fourth, good laws are generally developed, implemented, and reviewed and improved in partnership with the community. The laws themselves are better because they connect with and are informed by people's lived experiences. Trust in the laws and in government is higher, and ordinarily compliance is then higher too. In the case of digital technologies, success will ultimately depend on people's use of technologies. This can't be taken for granted. Engagement doesn't just happen. Fifth, we know that the private sector has enormous impacts on health, both for good and not so good. In respect of digital technologies, private sector technology providers have a range of commercial interests in the use of both their products and information that's collected through their products. So it's essential that these arrangements with the private sector are well managed. And as we know, some of the major private technology providers have greater resources than a number of countries in our region. So we have to find ways to harness the powers of what private technology providers have to offer while avoiding conflicts of interest, misuse of information, and the development of unhealthy dependency on private sector actors. And my final point is that we all know that health is global and that international cooperation is essential for health. And I think this is particularly acute in respect of digital technologies because data information can be shared across countries, across the world, in the blink of an eye, at the stroke of a key. So we need to cooperate and collaborate in respective legal frameworks and in the sharing of knowledge and expertise. Individual countries can't succeed alone. So I'll leave my comments there, and very much looking forward to hearing fellow panelists and to the discussion. Thanks, Daryl.
Thank you very much, Jonathan. Fantastic presentation. And I will say I appreciate you keeping the time. I know that we've made it tough for all the panelists to keep your presentations to 10 minutes. So thank you for doing that. And really, I think for me, the key message, one of the key messages is about, you know, getting back to basics. Digital technology is exciting and fascinating, and it is where we're going. It's the future now. But there are still so many basic elements that we need to get right as we move forward. So thank you once again. We're going to now move to Dr. Elvin Marcello for his presentation. So Elvin, over to you.
Thank you, Daryl. Good morning, everyone. It's a pleasure to be with you this morning. Daryl requested me to talk about digital health governance and our experience at the Asia eHealth Information Network, and allow me for the next few minutes to present to you the work that we've done for the past 10 years and also some experiences we had in adopting this in the Philippines. So WHO defined eHealth in 2005 as the use of ICT in healthcare. And I think recently there are several World Health Assembly resolutions that had already used the term digital health. For purposes of my presentation, I will be shifting from e-health and digital health, but I would be referring to the same thing. Jonathan gave very significant points about the importance of stakeholders in good governance. And in digital health governance, which I would say as the combination of health governance and IT governance, you would basically have the same framework. You would have your stakeholders at the center of your governance direction, and you'd like to make sure that they are able to achieve their benefits, we're able to control their risks, and we're able to provide the right resources so that they can benefits and minimize the conversion of risks to problems. And on the health column on the left side, you would see some sample benefits. For example, in health governance would be universal health coverage, quality, accessible, cost-effective healthcare. The risks would be to decrease the spread of the disease and make sure that the people and the citizens have financial protection when they get sick. And in the end, you would have to provide resources that could be manifested through the health investment plan. And you basically come up with a good health outcome when you have your healthy citizens. On the right side, good governance in IT would entail that the citizens who would be your stakeholders would have the benefits of efficiency, accountability, and traceability of transactions. The risks that you would want to control is breaches in confidentiality, in integrity, and availability. And the resources, again, would end up with an IT investment plan. And you would end up with an outcome of having trustworthy systems, citizens who are happy and satisfied, trusting the IT system that they are using. So in the end, health governance and IT governance would be a combination and would result in the digital health governance. And I think you might think that it's health governance by itself is already complex, and IT governance by itself is already complex. And combining the two into digital health governance would be doubly complex. But as a matter of fact, that the governance structure makes it easier to implement digital health governance if you adopt a framework for both of them. And what framework are we adopting at the Asia eHealth Information Network? Well, the WHO and the ITU released this document in 2011-2012, the WHO ITU National eHealth Strategy Toolkit. And they had a framework here that showed 7 components like leadership and governance, strategy and investment, legislation, policy compliance, workforce, and a vertical stack of services and applications, standards and interoperability and infrastructure. I thought in 2011, when we first talked about this and launched it at the AHIN conference together with the ministries of health in our region, we thought that this was the framework that we were waiting for and looking for as a set of guidance. Before this, the health sector would proceed and create their own digital health or e-health projects. And some countries would have the ministries of ICT leading the e-health projects. But with this framework, it was very clear that it was the leadership of the health sector, but with the participation and collaboration with the ICT sector. So I think the framework was a very strong signal from both WHO and ITU that this e-health would only succeed if partnership and collaboration across sectors was done. And I'd like you to focus on that red that shows this specific part, which I think is the IT part of the e-health strategic framework. And it's actually stacked vertically because in fact, they should be implemented in sequence. First, you have to have good infrastructure. On top of your infrastructure, you should have standards in interoperability. And after you have your standards in interoperability, you would then have your services and applications. And the idea here is if your services and applications are using the standards on a common infrastructure, then you would have your IT systems or digital health systems working well. So let's expand that red triangle and look at existing digital health infrastructures and standards and interoperability. And this is one framework that we have been studying and detailing at the Asia eHealth Information Network called the Open Health Information Exchange. It's a very simple framework that says in the middle, you should have an interoperability layer, and at the top, you should have your standards. You should have a standard for your citizen ID. You should have a standard for your providers, a standard data set for your facilities, and a standard data set for your clinical or terminology. I think it's simple enough for many ministries of health to understand and for many ministries of ICT to comprehend. But even then, this simple blueprint, as I would call it, takes some challenge because not one entity could actually implement all of the components. Those components might be owned by a different government agency in the country. For example, the client registry might be with the Vital Statistics and Civil Registration Office, while the health worker registry might be with the Professional Regulatory Commission, and the facility registry would be in the licensing department of the Ministry of Health, while the interoperability layer might be more in the domain of the Ministry of ICT. And I think it's because of this complexity of the digital health blueprint where you have to have many stakeholders and many sectors coming together and participating is the very reason why you need good governance. Because to make this digital health blueprint work, you have to have all of these stakeholders represented around the table, implementing their respective projects and making sure that their projects are actually synchronized with each other so that not one component is lagging behind the other, making the whole system fail. And I think that's the challenge now with digital health is that we need several sectors to come together and collaborate and make this thing work. So let's look at the experience in the Philippines. Coming from the WHO ITU National eHealth Strategy Toolkit, the Ministry of Health and the Ministry of Science and Technology back then in 2014, which was the precursor of the Ministry of ICT, came together and said, okay, why don't we adopt this framework and follow the WHO ITU 7 boxes? And I think I don't have time to present all the boxes, but I think the box on leadership and governance is the one that really stands out from that implementation in 2014. And that they created a governance steering committee, which is a structure actually composed of the National eHealth Governance Steering Committee, chaired by the Minister of Health and co-chaired by the Ministry of Science and Technology, participated by the National Health Insurance Corporation, the National Health Sciences University, and the Department of social works and welfare. And then below them, they would have the technical working group, which are their people second in command, who would then be the ones really taking and doing the hard work in terms of managing the e-health framework for the country. And then below the technical working group would be our workhorses, the program management office, which is actually a collection of the project managers of the respective agencies, meeting frequently, making sure that they're synchronized and implementing the tasks that have been assigned to them by the technical working group. And early on, one of the things that were agreed on that was that they needed to have resources. We needed standards because it was in the toolkit, but there was no expertise in the technical working group. So they created a multi-sector group called the Standards Expert Group. Privacy became a concern. It was elevated to the technical working group as a concern of one of the stakeholders, and so they created the Privacy Expert Group, and so forth and so on. We knew that there were already electronic medical records in use in the facilities, so it was proposed and agreed that there would be a stakeholder group called the Electronic Medical Record Committee. So in all of these, I think what happened, and it really benefited, is that there became a system for decision making, a system for thinking through issues and concerns and getting them resolved, and an escalation process, which I would present in the next slide. So basically, if you look at the previous slide, there's actually two layers there. There's the governance layer and the management layer. So this is from COVID-5, a governance and management framework for enterprise information technology. And if you look at the governance part, which is the role of the ministers in the Philippine e-health steering committee, their role is to evaluate the needs of the stakeholders. After their evaluation, they would then give directions to the technical working group. These directions will then go to the management domain, and the technical working group's role would be to start planning projects that will be able to address the directives coming from the steering committee. Those plans will be built. After they are built, they will be run. And while they are running, because this is digital health, so you would have data flowing continuously, you would have an operations monitoring system to advise the management that everything is actually working well and the lights are on. This same monitoring feeds into the strategic monitoring of the governance body, which they then use to again re-evaluate whether their stakeholders are achieving their benefits, minimizing the risks, and making optimal use of their resources. So these two layers of governance and management, and in the Philippines, that would be the steering committee and the technical working group, really proved to be very effective because it clarified who's accountable, that's the governance steering committee, and who's responsible, that's the technical working group. And at some point in that structure, there came to the table a lot of issues. And so we could not present all of the issues to the steering committee and the ministers. They were very busy. So one of the things that was escalated to the steering committee was this escalation process for decision making. The technical working group would then talk about their issues from their own sector's perspective: health, ICT, insurance, education, social welfare. If they gain consensus, they don't need to get the permission from the steering committee. They can continue implementing their projects and programs. But if the technical working group is unable to gain consensus, they should be presenting this to the steering committee for their resolution. If it's very urgent, the technical working group was authorized to call for an emergency meeting. If it is not urgent, the technical working group should present it in the next quarterly steering committee meeting. So this decision-making process was very effective and powerful because it empowered the technical working group in consensus to move forward with their programs without having to delay and burden the ministers, but at the same time give them a lifeline. In case they needed the support of their ministers, they could not get into agreement, the ministers would make themselves available. So last two slides. Digital health governance, in summary, is basically about formalizing the decision-making governance structure. Who is accountable for making decisions about the strategy, and about investment, for example. And we saw that because of the digital health blueprint that entails resources for the different sectors, this decision-making governance structure is best multi-sector, because the commitments will come from the different agencies, from health, ICT, local government, economic development, and the Privacy Commission.
Hi,
Now,
Alvin.
because
I'm
these
so
are
sorry.
coming from...
Hi, Alvin. I'm so sorry to interrupt. I was wondering if you could go just to your final slide, because we have gone over and we need to give everyone time. So if you could just give us a 30-second
So finally,
key point, that would be fantastic.
All right. Okay, so multi-sector governance for digital health is the recommendation, focusing on stakeholder engagement and making sure you address their needs, and good governance, having clear strategy and directions, regular meetings, escalation of issues, the resolution, and monitoring and evaluation. Thanks, Darren.
Alvin, thank you very much. I know that you were right at the end. I'm just conscious that we're giving little tasters, little morsels today. So thank you. I'm sure there'll be lots of questions in the chat. So with that, I'm going to now ask our colleague from the Solomon Islands, Ms. Bakai Kamariki, if you can please make your 10-minute presentation, and if you can try and keep it to 10 minutes, that would be great. Over to you. Thanks, Bakai. I think you're on mute. Hi, Bakai. I think you're on mute. Thanks.
Hello, good afternoon. Can you hear me?
Yes, thank you. We can.
Thank you. Thank you so much, Darren. And good afternoon to everyone from the Solomon Islands. It's a great opportunity for us to be part of this important forum. As you all know, Solomon Islands is one of the countries in the region that has also implemented various digital health solutions, while it lacks the holistic approach to digital health, which has resulted in fragmentation of ICT operations, duplication of efforts, wastage of resources, and so forth, and may also have lacked common standards. In this presentation, I will share the country's digital health journey to date and some of the approaches now that being taken by health and the whole of governments to better coordinate and implement actions pertaining to digital innovation in the country. The next slide, please. Next. As we can see on the slide, there are numerous digital health solutions have been implemented or adopted in the health sector, and this has over the years improved the way in which health information are collated, processed, and made available to stakeholders on a regular basis, as well as improving some of the health service delivery in the country. However, more is still needed to maximize the use of ICT solutions to better support the health service delivery and monitoring of health activities. With the landing of the Coral Sea fiber optic cable in the country, along with the government's new initiative on the last mile broadband tower project, there's a great opportunity that digital transformation in Solomon Islands will grow at a much faster pace. Next slide, please. So what happened in health sector recently is that the National HMIS Committee, which is a multi-sectoral committee, has established the Technical Working Group for Digital Health. The Technical Working Group has been charged to lead the work on the development of the digital health strategy, as well as being responsible for digital health activities. However, there is also recent discussion that digital health strategy could be considered or factored in the next 5 years National Health Strategic Plan, which is currently on review. Also, health is working very closely with other government agencies, such as the government ICT departments and the Ministry of Communication and Aviation, to ensure that health priorities are considered and embedded in the whole ICT and telecommunication improvement plans. Next slide, please. So in terms of the whole of government approach to digital transformation in the country, there is a growing support from the government to modernize all government services with a common goal to deliver an effective and efficient for the people. So the government's ICT department has launched a 5-year ICT strategic plan early this year. The plan embodied the SIG commitment to transform and modernize government services through effective delivery of ICT services. On top of that, it has also developed a national ICT policy that aims to provide a policy to direct changes in the ICT environments where people and organizations in the Solomon Islands can benefit from. There are also other legal frameworks to be enacted as part of changes to the legal environment. And the new bills, and these are the new bills such as the cybercrime bill, the data security bill, and the data privacy bill. I think we over the slide. It should still be at the governance process slide. Yes. So while work on the cybercrime bill and the data security bill has already started, they are now currently on hold due to COVID-19. As for the data privacy bill, this will be drafted once the cybercrime bill has gone through cabinet. However, during the drafting of the data security bill, health has little input into that, but recent discussion between health and Ministry of Communication and Aviation indicate that health should also be involved. And so there's a plan to involve health on the work when work on data security bill resumes, and also when the drafting of the data privacy bill commences. Other policy framework that are also on plan is the National Digital Transformation Strategy. This strategy is currently led by the Prime Minister's Office and supported by WHO. Again, work has also started towards the end of last year, but further work has been stalled owing to the current situation. There are also other frameworks currently on review, which may also support the digital innovation in the country, and these are the Birth and Death Acts by the Civil Registration Office, and also the plan. Next slide, please. So it is obvious that now that advancing digital health in the country will continue to be challenged by the lack of legal framework, policies and procedures to guide the implementation process. Low coverage of digital literacy among the health workers is also seen as another challenge in this space, and also poor infrastructure in terms of electricity power supply in the health facilities. Silos and fragmentation of ICT operations is also still a challenge. Duplication of efforts, no unique identifier to enable tracking of patients, and so forth. But what are the opportunities available for health? Next slide, please. So even then, there's still some opportunities now available for health to take advantage of in terms of advancing digital health innovation in the country. And these are the landing of the Coral Sea fiber optic cable in 4 stations in the country, for which we have already felt its impact. The new government initiative on the last mile broadband tower project that the Ministry of Communication is currently leading, and work in collaboration with health, education, and police for prioritizing services and areas. There's also a growing political will in the use of ICT for the delivery of services and increasing support from the public and the private sector in the telecommunication field. Next slide, please, and that should be the last slides on the presentation. So the plans and the innovations that we have that currently on that could build the capacity and integration of new technologies to support the health services deliveries. We need to expand and progressively roll out the DHIS tool. There's also a plan to pilot the telemedicine technology, and this is being supported by the government ICT department. Also, the expand in the use of the computer tablet, especially in the areas of the data collection for verbal autopsy and the M supply. Strengthen the collaboration between health and other key stakeholders, and also Ministry of Health advocates the proceedings of various legal framework. And finally, to move towards system integration, especially between two systems, DHIS to Promadis, or more integration with the surveillance systems to avoid fragmentation, duplication of efforts, improve the data sharing and reporting, and then of course the ongoing implementation of the role delineation policy. Thank you.
Makai, thank you very much for that fantastic presentation. I'm really impressed you kept the time. I know that it's really tough when there's so much going on in the Solomon Islands, so much good work as we've been discussing. And, you know, the highlights there were really around the need for those legal frameworks to be in place or to be updated. And again, looking at the infrastructure as, you know, a basic prerequisite. And, you know, you've already got examples that are working well in Solomon's. You know, you mentioned a few. M-Supply, I think, will be picked up later by Michael. So thank you. Thank you to all our speakers, Bukai and Alvin and Jonathan. I'd like to now give the floor over to some questions, and we'll give the opportunity for those coming through. We've had some come through on the Zoom chat, but to start us off, I'm going to ask our colleague, Mr. Shane Walter Hurrell from Tonga. He's the Chief Information Officer at the Ministry of Health in Tonga. I'd like, Walter, if you could give us your reflections on the presentations and any questions you might have for the panelists. So over to you, Walter.
Hello, everybody, and good afternoon from Tonga. And thank you for the opportunity, Daryl. Give just a few reflection and also a couple of questions for the speakers. So as mentioned by Daryl, I'm from Tonga, and I'm representing the FIN entity, which is the Pacific Health Information Network. It's actually the little brother of AHIN, Asia Pacific Network Health Information Network, represented by Alvin. So going back to the presentations, I just want to understand more about when we're putting good in front of the governance. We've heard some presentation regarding the governance, but I want to understand more about what do you mean by good governance. So how do you know when what you actually have implemented as good governance in your respective countries is actually good? So we can actually learn from us in the Pacific if that solution is actually can scale down to the Pacific level, or is it one fit all solution? So maybe I'll pass it on to maybe Alvin or anyone from the presenters to actually have a bit of talk about that.
Thanks, Walter. I appreciate that. It's a great question. Maybe we'll start with Alvin. Alvin, if you can try and give us 30 seconds, maximum 1 minute of your response to Walter's question on what is the good in good governance, and then maybe we'll go to Jonathan and Bukai if we have time.
Thank you, Daryl. Walter, what's the good in good governance is basically stability of decision making, if I can use that phrase. Basically, having a regularity in the meetings, making sure that the high priority topics are discussed, socialized, and agreed upon on what's next to be done, and that the resources are made available appropriately to the risks and to the benefits. It shouldn't be very difficult for the leaders that we have already elected or appointed into the positions. That's basically what they're supposed to do, to listen to the people, understand what the people's needs are, and then giving back the people the projects and the programs that they need to get those benefits. Daryl.
Great. Thank you very much, Alvin. I'm wondering if Jonathan or Bukai, do you have a 30-second inclusion, or will we take another question?
I can do 30 seconds. Bukai, do you want to go first? Maybe I'll go while she's turning on. So I think just two things. I thought that Alvin's presentation did a great job of showing the importance of connecting the technical with the decision making and the processes to put in place to make sure that that's happening. And the second is to Walter's to the specific question. I think good governance looks very different in every setting, and I think we can learn a lot from each other about the things that we take into account and the ways in which we apply those in our individual settings. But they will have to look really different, but in terms of the infrastructure, in terms of the size of the population, and in terms of the legal regulatory frameworks that make sense.
Great, thanks, Jonathan. I wonder, Bakai, do you have any comments that you'd like to share on good governance from your perspective? Hi, Bakai, you might be on mute.
Yeah.
Yep, that's it, we can hear you.
Maybe just to share some experience from Solomon Islands. I think it is still, and this will be a practical experience. It may not be different from other countries, I suppose, but I do agree in terms of the regularity of the decisions to be made by those who have been designated to do that, especially on the technical working group. So for Solomon Islands, because we just set up the technical working group, which is established by the HMIS committee, and even then we see some changes and some way forward in doing collaboration work with the Ministry of Communication and ICT government department in terms of advancing the digital health and getting health more involved into the whole aspect of the government's and the whole approach of digital transformation in the country. So I think I really agree that strong support, strong leadership, and good that should form the basis of good governance, because without that technical working group working and the HMIS committee that provide the oversight on the technical working group, nothing can be progress at the first initial stage. Thank you.
Thank you, Bakai. Couldn't agree more. And it's great to, again, have your perspectives from the Solomons. So I know we've had a few other questions come in, and what I'd like to do is to actually shift those to the second discussion point after our next three speakers, because there are some questions that may be able to be combined. So once again, thank you to Bakai, Alvin and Jonathan for your fantastic presentations and kicking us off. And also for Walter from Tonga to stir it up a little bit and give us some thoughts to get that discussion going. So with that, we'll now continue with our next block of speakers. And I'll pass now to Ms. Shan Zhu from China, who will give that first presentation in the block. Shan, over to you.
Hi, Dario. I'll share the screen, just a minute. Yeah, so great honor to be invited to this very important forum, and especially my favorite part on digital health.
Thanks, Shan.
Yeah, can you hear me and see my screen?
Yes, we can hear and see your screen, no problem.
Okay, I'll go ahead. So during the last 2 days, actually, we have many fantastic discussions on innovation, about rethinking, redesigning, re-image, or redefine what kind of health future that we need. And among all the forces that force us towards that future, I believe digital technologies can be a great assistant if well understood and well designed, and of course under reasonable governance, as our previous panelists have said. And so today, I'm not going to talk about very fancy applications. I'm going to talk about to provide a better environment to make that fancy applications happen. So or my observation is based on the special position of the CICT. So CICT is the full name is China Academy of Information and Communication Technology. It is a research institute over 60 years old under the Ministry of Industry and Information Technology. So why it is special positioned, I would like to describe it as a link of the digital health ecosystem in China. So on the top, you can see we link to different parts of the government with policy support, and then we collaborate with various stakeholders in digital health industry by the national projects, laboratory test, and also the industry alliance. And thirdly, we also develop some standards and benchmark system to support sustainable development in the system level. So actually these three layers can be our sensors that makes up our understanding and also the experience that I'm going to share today. So my first point is to set up a national agenda for digital health development. Let me just take an example. So this chart shows a structure of Chinese digital health policy with the corresponding timestamps. The red boxes stands for overall policies launched by the state council, and the blue ones are specific areas that launched by the National Health Commission, and the gray one are from other ministries such as the ICTs, finance, or science development. So this chart can also be seen a good example of the cross-sector collaboration between government. And just to make it more clear, we just escape the details and take a brief look at the structure. So based on the problems that we are going to solve and also the version for future innovation, a national overall strategy is on the top, and then followed by the action framework, consists of the feasibility analysis, such as the preparation on ICT infrastructure, and then followed by some key directions. In China, they are actually Internet Plus service, big data, and AI applications that they have set up policies in China. And then we can also think about how to better integrate these innovations with the existing services. And finally, as our previous panelists have said, it is important to have an evaluation and monitoring part, including the indicators in cost and benefits, so we can better design and decide how we can continue in the future. And then the second observation is from our second sensor, that is the industrial collaboration. So to build a digital health community, it requires efforts from multi-parties, from the government and also the academia, and as their scientific guidance and the industrial alliance or benchmarks to make their sustainable development in a large scale possible. So here's are just some examples that CICT actually engaged and facilitated in China. So I just listed all the examples here and also with the corner marks for your reference. And as time limited, I just pick one typical cases on the government side. And as we have discussed yesterday, we know it is not always easy to build a cross-sectoral collaboration within the government. But actually, we can try to start with some baby steps or as the first handshakes, just as what I have showed in this slides, the picture 2 and 4. It is a kind of collab between their subunit or research center that under the different ministry, not direct to the ministry. So under this kind of collab, one is about the big data and the other is the AI for medical device. So we cannot provide a guarantee or universal solutions here, but I would like to say let's try it step by steps on the collaborations in this ecosystem, and we are confident to bear some fruit in the future with our continuous efforts. So the last point and also the third tips that I would like to share is about their standards or specifications to deal with their interoperability. As Dr. Evan have showed in his slides about the framework of ITU and WHO and e-health framework. And here I just want to emphasize the importance of the interoperabilities because it is a common problem for most countries, regardless of the developing level. So this slides is actually taken from the paper that we work for ITU telescope last year, and it tries to discuss the evaluation path of digital health. And during their penetration, you can see the arrows that are marked here during their interactions of ICT into the health system. So, so network and data flow are two driven factors that to promote multiple system integrations. But how can we ensure the connectivity of different network, data format, and system interface? Actually, it is really a mess, and I think every workers on the digital health or information systems understand the pain of their data and inconsistency. So garbage in and garbage out is always the case. And actually, it is not about the high tech. It is about the consistency and the rules, standards, or specifications. As long as this interoperability problems is well solved, and then it is possible for us to truly expect the potential power of the cloud computing, the AI applications, and also the more fancy solutions on the Apple level. So, okay, this is my summary slides of the takeaway message with a top-down approach. So the first tips is to set up a national agenda for digital health development. It should start with the real-world demand, with the general methodology that I have shared today. I think you can develop an adaptive roadmap of your own based on your need and also the development level. And then the second is from the industry perspective to encourage various activities and information exchange. And as we all know, the digital health innovation is always not a separated island. It relies on the solidarity and operation from multi-parties. And then the third is about the system implementation layer. Just pay attention to the interoperability problems as early as possible. It will lay a good foundation for the upper level innovations. And it does not require a very high barrier. You can start with cross system specification on data and network, and then cross institution, then gradually to their industrial standards, and finally to national or international standards. So that is all about my presentation. Thank you so much.
Thank you, Shan, for that really great overview of the developments in China. I know it always seems complex and, you know, a lot of different moving parts, but I think, you know, there are a lot of basics that all countries can take away, you know, considering the development of a national strategy and an action plan. And then this wide collaboration keeps coming up through the presentation. So thank you for your time and your presentation. I would like now to go over to Fiji, actually, where we're going to hear from Dr. Alicia Sahukan, who, as I said before, is the head of health protection at the Fiji Ministry of Health and Medical Services. So, Alicia, over to you.
Hello, and thank you for the opportunity to present on behalf of Fiji. I think you're controlling the slides on that end. Okay, great. First, before I go into my presentation, I thought I'd better give a quick overview of Fiji in general. So we're an independent country of over 300 islands in the South Pacific. We have a population of close to 900,000 people, and we're classified as an upper middle income country. We're quite remote. Of course, we're in the South Pacific, but we're not disconnected. Within the South Pacific, we are a travel, business, and education hub with regular, before COVID-19 the pandemic, of course, we had regular flights to different parts of the world, including New Zealand, Australia, the United States, Singapore, and Hong Kong. In terms of COVID-19, I'll give you a little bit of an overview of where we stand, because this contact tracing app technology that I'm talking about is very much related to COVID-19. So Fiji has had 32 cases in total reported of COVID-19 and 2 deaths. Our first case was detected on March the 18th. And our first 18 cases were actually between March the 18th and April the 19th. And these were all either travel related or contacts of travel related cases. Since then, our remaining 14 cases to make up the 32 have all been found in our border quarantine facilities. So at the end of March, after our first case, we mandated that anyone coming to Fiji, and at that point it's mainly Fijian citizens, needs to go into mandatory government supervised border quarantine facilities. So in a nutshell, Fiji has largely escaped the full impacts, the health impacts of COVID-19 to date that we've been seeing devastating many countries around the world. And why, and how did we do that? Well, what did we do? Well, we did it all. We did everything, all of the major interventions that have been recommended and have been proven to work worldwide, we did most of them. So of course, the classic public health response to infectious disease outbreaks like this is finding cases, isolating them, testing them, and treating them. And then of course, finding their contacts, quarantining their contacts, testing them. And also, in addition to this, was our very strong border control measures. And then again, together with this was targeted lockdowns of affected areas and promoting social distancing and hygiene. Essentially, we did it all. And so now this brings me to this contact tracing app. Of course, in the early days, when we first had our first 18 cases that were in the community, we relied on traditional contact tracing methods. We had recently had a national measles outbreak, and that really helped us in a way, preparation for COVID-19. But of course, measles, though more contagious than COVID-19, it has a vaccine. In particular, out of the first 18 cases, 2 were a challenge. 1, because of the nature of the person's occupation, we had to contact trace 3 separate international flights. With one of the other cases, there was inter-island travel on a ferry. So this really stretched our contact tracing capabilities at the time. And from that, there was development of this app, which I'll go into now with my presentation. If you go to the next slide, please. So Care Fiji is a mobile app by the Fijian government under the Digital Fiji initiative. And it's aimed at being a supplement to our manual contact tracing efforts, which are well established. The app is based off the original app that's came out of Singapore and mirrors the COVID Safe app that has been widely adopted in Australia. Next slide, please. And this is just a video presentation of the app.
We don't have any sound, Alicia. I wonder if while we're fixing that, if we're not able to fix it quickly, we could keep going and then maybe play it at the end. Just check with our tech support.
Okay. So essentially, the COVID tracing app, Care Fiji, is a proximity, hold on. It's a proximity tracing tool that solely uses Bluetooth low energy technology. It does not use GPS, and the only information captured is an encrypted phone number, date and time stamp, and the duration of close proximity. And currently, contacts are logged if you're within 2 meters of the person for 15 minutes or more. And it only requires a phone number to register for this app. The data, of course, is anonymized and stored in the phone and only accessible to the Ministry of Health if a positive case gives their consent and then sends the data physically from their phone. It uses virtually no mobile data, although 10 megabytes is required to download the app onto the phone. I'm sorry, are you playing the presentation?
I think we're just trying to get the sound up, but what we might be able to do is just park the video for now and keep going on the presentation.
Thank you.
Yeah, thank you. So perhaps I'll just get my tech team who are controlling this to scroll past the video, and we'll see if we can pick it up later. Okay, so we're back on the slide chat.
Yes. So essentially the app only uses Bluetooth to capture the information, which is just the proximity, duration of contact, as well as the phone number of someone else who has downloaded the app. Next slide. All information is stored on the phone, so it is and uploaded should someone test positive, and then give the Ministry of Health consent to download the data. Next, please. It uses minimal battery and Bluetooth low energy, and very little data, which actually is reimbursed by our network providers in Fiji. Next, please. It's available for download on both the Apple and Google Play Store, and of course went through the extensive review process to make sure that it functioned in line with what our stated privacy policies were for the app. Next, please. MIT had reviewed 47 contact tracing apps. And what they found was that the Care Fiji app that's based out of Fiji was transparent in the information that was provided to the public, and that the data collected was minimized when it was very minimal compared to apps that have been launched across the world. So essentially, we don't ask for address information. We don't have any geo-tracking requirement on the app. It's just a use of Bluetooth technology. Next, please. Okay, looking at the adoption rate, we had found that about 95% of the smartphones that were in Fiji can download the app. As of 2nd September, we had over 71,000 downloads, which was about a 13% adoption rate in Fiji. Next, please. So in comparison to other countries, Australia has a 40% adoption rate, Singapore 35%, and Iceland, which is the highest adoption rate of any country, was about 40% as of July the 8th. Next, please. Some barriers to adoption were similar to other countries where misinformation about the data that was collected and privacy issues was shared publicly on social media networks, etc. And it really was, the onus was on the government actually to put out information about exactly what the app was doing and the data that was collected, as well as any concerns about privacy. But it is something that continues to be a challenge in uptake of the app. Next, please. So in terms of countering the barriers to adoption, as I mentioned, ensuring that the correct information was put out there and there was a mass media campaign was very important, as well as involving whole of government and other civil society organizations in promoting the app and ensuring that the right information was out there about the app itself and the benefits of downloading the app. Next, please. There's some take-home messages. Mobile app technology has the potential to assist in traditional contact tracing, particularly when looking forward to the future, beyond closed borders, etc. Once we start opening up borders, contact tracing apps can be seen as something that has the potential to really help us with our contact tracing efforts, but it is dependent on user acceptability and adoption, and it still relies on a jurisdiction having the traditional contact tracing capabilities with the app as an adjunct to that ability. And of course, comprehensive communications are required for successful adoption right from the initial launch of such apps. Thank you.
Thank you, Dr. Alicia. That was an excellent presentation. I'm really sorry about the video. I think we're still trying to work on it. But I mean, a couple of key points that came up for me is really how you've tried to look at some of the equity issues around data usage and, you know, how much someone would need to spend. And also you touched on issues around strategic communication, because as you said, you know, we've got to get the public with us on these new technologies if we're going to be successful in using them. And then one other point towards the end, when you mentioned about this being a complement to traditional contact tracing, I think that for me that resonates with Jonathan's first presentation around just getting the basics right. Before we even look at digital or innovation issues, what are we doing in the health system to address some of those long-standing issues? So thank you very much. We'll still try and get this video sorted out before the end, but I appreciate your time. I know you're very busy, and thank you, and we'll see what questions come up. So with that, I'd now like to ask our third speaker for Block 2, Dr. Michael Noonan from Beyond Essential Systems. Michael, if you'd like to take the floor as it is and start your presentation. Thank you.
Thanks, Daryl. I should check that everyone can hear me before I start, I guess, but
yes,
okay, so.
I think we can hear you. Thanks.
And can see my presentation is the other.
Yes, yep, we've got
cool.
you.
So thank you to everyone, really. I am speaking with a fairly free rein today, or I think it's a free rein, and really wanted to raise a few sort of thought bubbles that I think go along really nicely with some of the things that have been talked about today. I am feeling very conscious. I have imposter syndrome today, particularly speaking with Bakai, Walter and Alicia before me, who are all extremely senior in health information systems in the Pacific. I'm feeling very junior, but it's a real honour to be part of the forum today. And on behalf of the Pacific, really wanted to highlight in particular PHIN, which Walter spoke to, the Pacific Health Information Network, which is it's a really good and contextually appropriate mechanism for raising some of these issues. So it's really nice that they've been highlighted today as well. I'm very conscious that we're not sort of spruiking products, but to just to put it in context of some of the softwares that we work with, and quite focused on the Pacific. M-Supply was raised earlier today. We also work with DHIS2, Tupaia and Tamanu across quite a few countries in the Pacific and a couple of countries in Asia. And we, I guess, are expert at implementing them. And my role in different countries is to lead the implementation of several of these softwares. I am talking today about some barriers or solutions around governance, around systems, and as I say, really just putting up some thought bubbles for people to shoot comments at and shoot questions at. I don't have necessarily solutions, but maybe just a few relevant opinions about what works and what's important and what doesn't work. The first is cloud architecture. This comes up a lot in our work, and I think it's really, really poorly understood in many low resource settings. There's a fear of cloud architecture in a lot of cases, and restrictions around legislation and policies make it difficult in some cases to implement cloud architecture. And that's in some cases a shame. There are a lot of myths around cloud architecture, and I think an imbalance in some people's minds of the relative risks of different things. And I think this is an important thing that donors and health information networks should be leading on, talking about things like explaining legitimate concerns, but how they can be managed within a cloud architecture, and understanding of the real versus perceived risks. So if you store your data on an AWS data center in Sydney, there's a tiny risk that the US government might subpoena some of that data, as if they would necessarily want to for whatever reason. But there are real and really high risks of storing data on a local server in someone's office, in a hospital, close to water and in a cyclone, region. And understanding the balance of those risks, I think, is really important. Nothing is risk-free, but I think in some cases people are more scared of cloud architecture than they should be. And it's an important conversation because in some cases countries are adopting legislation that prevents, for example, patient data being stored on cloud architecture. And particularly in some of the smaller countries of the Pacific, local data storage, local data centers are really not feasible, excuse me, or not necessarily appropriate. And so these conversations need to be had now before policies and legislation get put in place. A couple of people have touched on this, population identifiers, and I don't want to get too much into the technicalities and the differences between various different ways to identify your population. But I think whilst population identifiers are quite unusual, particularly in the Pacific, having unified patient IDs, there is an opportunity for countries to leapfrog mistakes, and it should be seen as an opportunity rather than a problem. We have this problem in a lot of highly developed, high income countries. So whether it's Australia or the US, where unique identifiers have been allowed to be developed by individual facilities, in some cases, particularly in the US, by individual states. And those unique identifiers don't necessarily travel with patients across facilities and across jurisdictions. And unpicking those problems is super difficult once you're far enough down that path. So even in Melbourne, where I live, if you move from one hospital network to another hospital network, your patient identifier doesn't come with you. And there's a lot of work going on to address that, but that work needs to take place and is hugely expensive because of the history that sits behind those unique identifiers. Now, why do I bring this up? Because it needs enormous investment, and donors, this is boring investment. And what we want to put onto donors is I guess, the pressure to think about this parallel to thinking about some of the more high profile implementation of e-health, of electronic medical records. There's a lot of boring baseline work that needs to be done. And it's also something that lends itself to a whole of government solution. And I think one of the early speakers touched on this, that patient identifiers can be the same as population identifiers, or at the very least population identifiers within your open HIE architecture can sit as a whole of government thing that can be pulled through an integration layer onto e-health platforms. And that can bring, so the investment in identifying people can bring benefits in education, in voting registration, in taxation, in driver licensing, whatever the case may be. And there's a lot of low-hanging fruit there that can be solved by investment in that area. But a lot of us believe that this is the biggest barrier to implementation of patient-level electronic medical record systems in a lot of countries in Asia Pacific. Open source models. This is maybe slightly more controversial because I know that there are mixed opinions about this, but our overarching point on open source and all the software that we work with is either free and open source or is moving towards a free and open source platform. And that, I think, is generally accepted now at the international level, that is a good thing. And there's a lot of commentary around the benefits of open source, about how to make open source platforms more sustainable. But that is not necessarily being translated into action at the national level. And by that, I mean when countries are advertising tenders for e-health software, when they are upgrading systems, when they are implementing systems even that haven't gone to tender, still there is, we think, a lack of translation from what is generally accepted. And I say that in inverted commas, at the international level down to the national level. And I think part of that is understanding open source successes and failures, and understanding what has caused some successes and what has caused some failures. And central to that is that the software is good. Being open source does not mean that the software is good. And so it's really, really important that having good fit for purpose software is the main priority. But in addition to that, that open source is a good thing. And of course, open source does not mean open source. There's huge number of different versions, and communicating to countries what different versions of open source licenses can mean and what the implications are for them in 1 and 2 and 10 years down the track, I think is really important. And of course, the caveat on all of that is that sometimes there's a specific need that an appropriate open source software doesn't exist for, or there's a specific urgency in which you need to get a private vendor in to do a really specific task. So it doesn't mean that you always need to use free and open source software, but that if you are doing long-term planning, that should be central to your e-health strategy. And finally, sync versus web-based. We talk about this quite a lot. What does sync first mean, and what are the problems with web-based models? There is, we think, a tendency to rely on web-based models, that is systems that rely on a live internet connection in order to function, that aren't appropriate, particularly in a lot of the Pacific Island countries that we work in. And that in a lot of cases, countries should know the difference between those web-based models, which again are often based on systems that might be implemented in an Australia or in America, where the quality and the reliability of internet is a lot more assured. Sync first means that there is a local version of the database that sits on the device at the health facility, and data syncs back and forth whenever the internet becomes available, so that the user has a seamless experience, even if the internet is to go down for long periods of time. And also that you don't get click latency. And click latency is one of the biggest barriers to uptake of e-health systems, particularly at the clinical level, at the bedside level. Click latency will cause people to stop using a system very, very quickly. So understanding the difference between syncing systems and web-based systems, where one is appropriate, where the other is appropriate, I think is something that needs to be discussed more, and it's not being discussed. And an example of a syncing first system is mSupply. Since they introduced sync-enabled systems in 2016 across their platform, it's allowed them to expand into some super, super remote areas and really overcome challenges that previous versions of the software couldn't. And I think that's right on my 10 minutes. So that's in 10 minutes, 4 huge thought bubbles that might provoke outrage or nods, hopefully more nods. But yeah, thanks for the opportunity to talk about them.
Thank you very much, Michael. Really interesting, and it's good to have some of those mythbusters to really generate some discussion, which is what I want to do next. But before I do that, I'm going to see if we manage to get the video up and running. So over to my colleagues to see if we can have the Fiji video.
Help in our campaign against COVID-19. Government's Care Fiji app. Care Fiji app is designed to help the Ministry of Health and Medical Services notify you at the earliest if you have come in close contact with a person who has tested positive for COVID-19. How does it work? Simply download the KFiji app and switch on your device Bluetooth. Bluetooth signals will determine when your phone is in close proximity to another device which has the KFiji app. If any KFiji user gets infected with COVID-19, he or she will be asked to upload their information, all while maintaining their absolute security and privacy. Visit the KFiji website on www.kfiji.digitalfiji.gov.fj for more information. Download the KFiji app today and help Fiji's campaign against COVID-19.
Great, thank you. We got it working, Dr. Alicia, in the end, which is good. And I'm sorry about that little digital tech hiccup that we had, but this is these are the things that we have to work out. So thank you again to Shan, Alicia, and Michael. And I know that it feels like we're moving fast, and maybe that's an analogy or a metaphor for how we're living our lives these days with COVID really entrenching us. But what I'd like to do now, I think we're going to go for a few extra minutes because we started a little bit late. I'd like to address some questions, but first of all, I'd like to go to Dr. Sally Fawkes, who is one of our colleagues, a senior lecturer in public health at La Trobe University in Australia, to provide some brief reflections on the presentations or questions for the panelists. So Sally, over to you, thanks.
Thanks very much, Daryl. Just checking you can hear well.
Yes, we can. Thank you.
Thank you. Firstly, thank you for the invitation to give some comments and to the presenters for such really interesting presentations about particular contexts and challenges. A few ideas came to mind as the presentations were unfolding, and having a great interest in health futures and the field of foresight. One of the ideas that came to mind for me was this idea of the futures triangle, where we think about the weight of the future, the push of the future, and the pull of the future. And I think that the pandemic has certainly brought into relief each of those factors. And of course, unfinished business that we might have in our health systems in terms of being able to achieve some of the goals of universal health coverage, for example, represent some of the weights that we're dealing with that are inhibiting our ability to change, perhaps to the extent that we want to, and make the most of all of the opportunities that come with some of the digital health innovations. And of course, then there's the push of the future, which is some of the trends pushing us forward, technology being one of the most stark of those, and the pull of the future. So some of these compelling images about how our societies could be, how they could function, how they could thrive, that are pulling us towards some of those futures. And of course, that all of those points remind me of the importance of leaving no one behind, as the Sustainable Development Goals tell us. Just commenting on two issues, perhaps. One is that we do have unfinished business. We've been reminded, I think, in the presentations that the basics need to be in place for innovation, such as the foundations for robust health systems and trust at all levels of the health system. And a number of presenters have brought up this issue of trust and the centrality of that condition. And we've been reminded of our unfinished business also in relation to creating, implementing and adapting governance arrangements so that technologies, old and new, are available, do no harm, produce maximum benefits and serve all in society. Wearing my health promotion hat, a very comfortable hat for me to wear, I'm hearing that we're talking quite a lot about digital health innovations that benefit individuals, that can be used individually, and would raise the opportunity also of the role of digital health innovations in relation to health promotion. For example, digital health innovations that enable people to mobilise others to transform local community environments and enable people to engage in social processes that meaningfully work on local determinants of health, including in low resource settings. And we think about assets and strengths in health promotion and not just deficits and weaknesses. We think about, in health promotion, of course, the settings in which innovations can be taken up not just in healthcare, of course, but from schools to recreation facilities, but also primary healthcare and other forms of healthcare. So I think some of the thinking we have in health promotion is really quite valuable for us to be using as we think about the development of digital health innovations and their rollout and scaling up. There are three questions that come to mind for me. One is that we often think positively about steps that we can take to scale up innovations. And I'm wondering about the value in modelling implementation failure so that we can gain insights into what scaling up of digital health innovations might look like. What does implementation failure look like, both from the demand side as well as the supply side? And will that kind of modelling help us anticipate some of the things we don't want to happen so that we can put in some mitigation efforts? The second question is around what is best practice in relation to when to involve the public in identifying the need for digital health innovations and then developing those innovations that depend on trust existing between government and public, and also the kinds of changes that we will be expecting communities to make, maybe in terms of time, how they use their time, how they use their money, and who they connect with. And finally, can we assume that some form of social innovation and need for governance innovation always accompanies digital health innovation? And what does that mean for those whose capacities might need to be developed? How might we do that capacity development work at the community level, at the civil society level? And what might we need to support with tangible funding in digital health innovation projects so that we're attending to some of those factors? So there's some comments in a very short period of time. I apologise for that telephone call coming through at a very awkward moment. Thanks, Daryl.
Thank you, Sally. Appreciate that great summary. It's always difficult when you've got so much information to compress. So I wonder, picking up on your questions, one question that came through was around lessons learned on cross-sectoral collaboration, and how can WHO, and this is for our panelists, particularly those in the second block who maybe haven't had a chance to speak yet, but really open to anyone, how can WHO best leverage its mandate and how we work and our resources to improve digital health governance in the region? So, you know, what are some of the failures? You mentioned that, Sally, in one of your questions. You know, what are the lessons that we've learned? And Shan, maybe I'll go to you to kick us off if you've got any reflections on lessons learned from cross-sectoral collaboration, even things that didn't work.
Hi, Dario. You want me to go first?
Yeah, if you've just got maybe just one sort of lesson that might be useful for us in terms of how we, you know, how WHO can best leverage its mandate.
Yeah, I think WHO is already trying to do that. I know that WHO are setting their digital health global community website and gathering all kinds of input, feedback from different national or religion communities from different areas. And I think the lessons from that is we can keep in touch and also have a global or overview guidance for different groups in different situations, different settings, or different countries, because they have different kinds of developing maturities and different situations. So that is what I answered briefly here.
Thank you, Shan. Yeah, it's always tricky because there is so much that we need to be doing together in this space, and there's a lot of ingredients in the mix. And I'm wondering whether Alicia or Michael, if you'd like to make some comments on that question, or another question that we had was really looking at the role of culture in our work. We've talked a lot about institutions. We haven't so much talked about individuals and the role that individuals or cultures play in digital governance. So Alicia, maybe to you, if you've got any comments on that or any of the questions from Sally, and then we'll go to Michael. I'm not sure if Alicia is able to connect. Michael, are you still there?
Yep, yeah, still here. I'm probably the least equipped to talk about the role of culture in some of the countries that we work in, but I did want to highlight one example. I was talking to someone about this the other day, actually, as I don't want to call it a failure, but maybe it's a lesson learned. And I'm not even going to name the country, but I was in the country at the time when they were doing a huge voter registration rollout. This was a Pacific Island country. And it included a biometric identifier. So they were getting the fingerprint of all registered voters in the lead up to elections later that year. And there were some fears that it would be culturally inappropriate to collect fingerprints, or that there would be pushback from people. And there wasn't. The uptake on it was excellent. It was really, really well run from an outsider's perspective. I have nothing to do with elections, but uptake was really good, and the system worked, and the elections were held quite successfully. I looked at that as just a massive missed opportunity for collaboration across sectors. And I think it talks to that cross-sectoral collaboration and what lessons can we learn. It's difficult. That is not WHO's mandate to run elections. How do they even know that, in some cases, an agency is planning to go and do those things? But it comes down to advocacy, at the highest levels of government, saying if there is the potential to be implementing a national identifier for voter registration, here is an opportunity with a fractional additional cost to implement a national identifier for education and healthcare, and save enormous amounts of money across all three sectors. And so I saw it as a missed opportunity more than a successful implementation. And just sort of use it as an example to illustrate where there are opportunities, but it's difficult for WHO on their own to do. So it just needs to be that constant advocacy rather than, I don't know if there's an easy solution to it, to be honest.
No, thanks, Michael. Appreciate that. I might now switch track a little bit. We had a question on legal frameworks, because we talked about, a few of the speakers touched on the importance of laws in moving forward on digital governance. So I'm wondering, maybe I'll go to Jonathan, and then we can reach out to perhaps Alicia, if you're able to connect, or Bakai. What would you say, how can we ensure that laws or legal frameworks can reflect the interests of society and balance that against private sector, who may sort of have the edge on some of this data work? Jonathan, maybe we'll start with you.
That's too big a question, Darryl, but I'll try.
Give it a go.
So I make a couple of thoughts. First, I think it's just how important it is to, I think one of the first points I made was to know what it is that we're trying to achieve, and then to be able to articulate what we're trying to achieve. So from a health perspective, why it matters, and build support for that. And then it does require, I think it really requires some analysis of how the problem and the interventions to deal with the problem engage different legal frameworks. So there's a really important, it's really important for the analysis. And then there was, I don't know if you saw, but there was some discussion in the chat. There was a couple of questions and answers from Alvin and from me. And coming back to, I think, your question about what WHO can do, I think facilitating international sharing of knowledge and experience, so that people in their interactions with the technology providers, and considering proposals that technology providers are making, considering the information that technology providers are giving, to somewhere to be able to check the accuracy of that information, which will be, of course, is given in their own interests. It isn't to say that it isn't also in the interests of health or in the interests of government. But so I think it is important to have a way of building that knowledge, being able to answer questions that are raised, and then also being able to work out what is it that private technology providers are going to gain if their proposals are accepted. So that's, I think I would say for WHO, I think there is a really important role. And a forum like this is a great example of doing that. So connecting people to be able to share their experiences and build knowledge, and particularly for people in health whose knowledge ordinarily isn't in the tech side of digital technology.
Thanks, Jonathan. Yeah, it is a big question. I think we could have had a 3-day forum just on digital governance. Maybe we'll put that on the wish list for something in the future. Look, I'm very, very conscious. We've gone over time a little bit. We started a few minutes late, but we've now gone sort of beyond our grace period, and I know that everybody is quite busy. So what I'd like to do now is have a look at the illustrations from our colleagues from Pushpin, who were looking at how we would represent the summary. So Gauden, I wonder if you would like to give any reflections, or if not, what I might do is just, I'm just bringing that up now. So we can see here, sorry, I'm just having a few tech issues on my side. So we can, you know, what I hope that we've looked at is sort of how we've started this panel looking at some of the foundations, and Jonathan really kicked us off at looking at particularly some of the legal frameworks that are important in not only setting a mandate and some of the restrictions, but also looking at how we're going to get this collaboration across different parts of the government and different parts of non-state actors' engagement in digital health. And I think it was Elvin's presentation where he mentioned really this coming together of the health sector and the IT sector, looking at digital governance and digital health governance. And I think that, you know, it's really important that while the health sector should be in lead on many of these issues, we can't do it alone, and no actor can do it alone. And then we sort of had some more specific examples from Bakai and from Shan and from Alicia, looking at how they were moving forward in different areas. Shan gave us quite an overview of some of the strategic processes of getting you know, whole of government and private sector and academia engaged. And then we saw some actions that Bakai was talking about in terms of the Solomon Islands work in setting their strategy and then looking at the hardware that's needed to support that, and also in particular bringing it back to the collaboration. And again, to come back on one of the answers from Elvin on what we need, and you know, it was echoed by Bakai, and that is stability in decision making. You know, this regularity of decision making, this certainty. And I think, given the COVID era that we're in at the moment, that certainty is sometimes difficult to get a hold of. And so I think if we keep that in mind when we're looking at all of these exciting, innovative technologies for health in the future, that we need to come back to the basics and look at what we need to do from a health system perspective and how that relates to any new technology that's coming in. So with that, I would like to once again thank all of our fantastic presenters. I know it was a tall order to fit everything that you've had in your experiences into 10 minutes. We managed by and large, but again, you know, we've gone over a bit, and I think it's an indication of such an important topic that digital governance presents. So with that, I'd like to also thank all of the attendees. I think that's the Zoom language that we're using. All of the attendees that have joined us either on YouTube or via Zoom. And whatever questions that come up that we haven't had a chance to address, we are taking that on board, and we will put it into the mix when we're looking at our next steps from WHO. So on behalf of the WHO Regional Office for the Western Pacific, thank you for joining this panel on implementing digital health innovation, and watch this space. So have a good afternoon, evening or morning. Thank you very much.